Good.
She looks a little rough right now.
No, she does. She looks good. They will develop what out of
Well,
her?
she can develop a fistula because the dental disease can be so extensive. Basically, there's a hole between the nasal sinus to the mouth. So when we actually pull the teeth, that she's going to bleed a little bit out of her nose. But we actually put special stuff in there.
So that's what you're watching to hopefully coagulate it?
Yeah, and then also to hopefully it will seal up so that she's not going to have a hole, like in the future when she sneezes, like food's not going to come out.
Oh, good. And so Boo Boo came in this morning at 7? 8?
Yeah, we have them come in 7:30.
Nice.
7:30. Yeah.
Nice. And so all the preparation, everything, she
She's
was good with you guys?
Yeah. She's a very nice dog.
You're a very nice puppy, huh? And you're like 14 now, 13 or 14.
I think she's 12 years old right now.
Is she 12?
Yeah, she's age 12.
Okay, my correction,
So
12. 10 when she got her.
her.
You're a pretty little girl. So Dr. Pan said Boo Boo had 4 teeth total, and now she's had to take them all out. And you guys will see pictures on our website.
And we'll actually, at 2 weeks recheck, we'll take more pictures and show you guys
Oh,
how
great.
good she looks afterwards.
Great. And she did great under anesthesia,
Yeah,
which
she
was
did
the
great.
owner's concern.
Yep, and prior to surgery, she did not want us to touch her face at all. She doesn't like us touching her face.
Okay.
I think just the teeth are so bad.
Yeah.
So she really resents anybody touching her face. So it'll be interesting to see after 2 weeks, when everything's healed up, she'll let us touch her face.
Okay. And so what are the x-rays? We're going to go look at the x-rays,
Yeah,
okay,
we're
Boo
gonna
Boo? Here's Desert View. They're all prepared. Great facility. If you're around Central Phoenix,
Yes.
right? Please check them because they would take care of your puppies.
This is one of the bottom teeth that we had to pull.
Wow.
If you look at the x-rays, there's a huge pocket and the bone around this root is completely just gone. It's not even around the tooth anymore. So this tooth was kind of halfway wobbly.
Not ready to come
second
out,
half
huh?
of the tooth is actually still pretty secure. So we had to pull this entire tooth, but we cut this tooth in half and then take out the bad root first, and then we work on getting this root out.
Look at that.
So that's one tooth that was really bad. Her canines had huge pockets. So this canine, you can see there's a huge pocket. There's hardly any bone around it. They were pretty wobbly and terrible as well. This is one of the canines.
So in all that buildup that you showed in the picture of
Here,
her teeth,
it's on the outside.
It's on the outside.
Yeah, it's on the outside of the tooth. But it does cause so much. It does eventually start to work its way down near the pocket.
Yeah.
And so that bacteria does cause the gums to recede as well as the bone to recede as well.
And then whatever bacteria is going in her blood system, and it could cause additional.
Sure. Yep. And dentists will tell you that dental health is huge.
Yeah.
This is a tooth, what we call a big molar in the back. So this tooth, you can see this. There's no bone around here. It's a 3-rooted tooth, and basically here it's just kind of floating in nothing, while a couple of the roots are in bone. The rest are just floating around.
Wow.
So it's just pretty nasty. But she's gonna feel so much better with these teeth pulled out. So she had only 4 teeth, and now she has none.
So what's the recommended treatment for Yolanda Boo Boo's
there will be no more oral. Like right now, after surgery, she'll be on soft food for about maybe 7 days until the gums completely heal. We close the gums close, so there won't be any holes left.
Okay.
And we flush out all the bacteria and everything out of there, and then we close and suture everything. So the gums should be healed in 7 days, and then if she wants to eat dry food, she can go back to eating dry food.
Right.
She can still chomp on it.
They're amazing like that. They are the ones I have one without teeth, and she eats like everybody else, and she has no restraints whatsoever.
Yeah, exactly. So she can go back to
her tongue completely falls out.
Well, this guy's tongue's gonna stick out. There's nothing to catch it anymore.
Yeah.
But I think she'll be much more comfortable and happy without any. And if you have like rotten teeth, every time you move your mouth, your teeth are just hanging or they're moving. It's really uncomfortable.
Yeah.
But now I think after everything's healed up, I think she's gonna be a completely different dog.
And so otherwise, Boo Boo's healthy.
Yes, that's
everything's good.
Yeah, I think after she has her teeth, everything healed up, she's going to be a completely happy dog, and she has many more years to go. So
that's awesome.
The whole point of it.
Wow. So we're so glad, viewers of the video, Dr. Pan, we've been working with Dr. Pan for over a year now, Giving for Pets, the GK Foundation, and Dr. Pan has been a huge fan of ours, right?
Yep.
I didn't coax her to do that. But we kept asking her to reach out to us, and we're gonna do what we can. So we're glad she did, because this is gonna be a great story, and we're gonna be happy for Yolanda and Boo Boo. By the way, is Yolanda, is she a standard patient? Or is this the first time you've seen her?
No, she came here for back pain.
Okay,
And
so the original.
we just originally she came in for back pain. Then I just saw the mouth. I was like, oh my gosh.
But before that, she hadn't been a
no, we haven't seen
patron
her before.
of you guys.
Yeah, she just brought it in because it had back pain, and then we looked at her mouth and we told her that she really needed to consider doing dental care, and she told us that she probably would not be able to do it because it was expensive. On top of it, she didn't want to anesthetize the dog because she was older.
She was concerned about her age.
Yeah, but I think this is going to make this dog so much healthier in the long run, and I think she has many more years to go. So this is a great way for her to start her senior years.
Senior years?
Yeah, I know.
And, you know, those that are viewing, I just want you to know, before we started taping, Dr. Pan was mentioning, you know, with this COVID, you know, pandemic that America's in right now, she's noticed that her activity in her veterinarian office has gone up. Patience of the people coming in has gone down. We all just need to be aware the veterinarians are doing whatever they can to help us take care of our fur babies. Be patient, be empathetic, be helpful, because they want to take care of your animal. They have limited hours and resources. So let's remember that, guys, that, you know, they're doing what they can. So if your vet can't take your vet, you want to go somewhere else, be empathetic and listen to what they have to say and how they can help you. Let's not forget that we're about taking care of an animal. And these are what the veterinarians like Dr. Pan do all day long. She wouldn't do this if she didn't want to, right?
Yeah, exactly.
She's a very huge animal lover, which I love about her. So this isn't just a business, but it is a business. So, you know, let's be mindful. Take care of your pets. Love them. We got an update next week. 2 weeks?
2 weeks. We'll check her in a week. We'll check her in a week for her mouth.
In a week, Dr. Pan will send us some more videos and give us an update on how Boo Boo's progressing. But what she's saying right now is it looks pretty damn good. So we're pretty happy for our participation. Most importantly, that Boo Boo's going to be good. So thank you guys. More to come. Appreciate you. Bye.